Good morning, Doc.
How are you?
I'm fine, thank you.
And you have done 23, or how many students there?
About 60,
60.
60 to 70.
60 to 70. I think here AC participant 65 with me and administrator. It means not all of you come in this morning, right?
Yeah, maybe later some will come later.
The first day of the week, yeah. Okay. Here, have you already participated in this blog? I think so, yeah. Mbak Nana.
Dalam, Dok.
Okay.
Tampilannya sudah kelihatan ya, Dokter Nyan Sewu?
Yeah. And all of you, my student, have you already seen?
Yes, Doc. Yes, Doc.
Yeah. Good morning, all of you. Here, welcome to Blok C.6, lifestyle-related diseases. It's a time for overview. We have 5 weeks and 5 scenarios. The blog aims to give student understanding and problems management concerning lifestyle-related diseases. You know what is the lifestyle? I think you know the lifestyle is classic bundle of behaviors. It makes sense to put others and oneself a given time and place. Here from WHO, lifestyle, healthy lifestyle is concerning determine physical activity, physical fitness, balanced nutrient, balanced mental health, social health. That's why in this blog we learned about lifestyle, our lifestyle and the community lifestyle and related diseases there. We have 5 learning units. Berikutnya, Mbak. Kita continue. And we have team in this blog. It's the normal team. The coordinator is Dr. Hasana Mumpuni, coordinator blog years. We have myself in the club blog, myself Studi Kandarina from public health, Dr. Zainal Mutahin from physiology, Dr. Yandri from internal medicine, Dr. Robi from internal medicine, and Dr. Silas Henry from mental health, psychiatry. As you know, what is the blueprint and the assessment? Here we have practical session and tutorial and block examination. We have 4 practical session, Psych 3, psychology, nutrition is from PPH, the statistics, epidemiology and public health department, and clinical pathology. The 3-1, psychiatry, psychology, and public health. We have 3 practicum. 3 practicum. We have what is the datum? The datum from 3 practicum will be as part of panel discussion if we discussion about our lifestyle in our life. Yeah, lifestyle data. The assignment tutorial we have normally 2 times, but now we have 1. So the same with another block. I one time to together tutorial synchronous, and another time to asynchronous steps learning, steps discussion, and we have 5 scenario. 3 is normal, 2 is normal. The third is some community scenario, and for the 4th and 5 with multi-level scenario. The block actually contains the first unit for risk factor disease. Should we continue, Mbak Nana? Here we know that the lifestyle, the principle is biomedicine, clinical behavior, and community health problems concerning lifestyle. Each model learn about prototypical convenience disease and health problem. We have no lifestyle we can process in individual and family and community. Here see the lifestyle, physical fitness with nutrition, physical, mental health, spiritual, social, and structural. If they don't in the harmonize and balance in the lifestyle, become health problems. It means diseases or another thing. The first scenario about risk factor of disease, the 5 scenario risk of disease consists of socioeconomic impact of illness, physical activity, nutrition, and psychiatric condition and disease. Also, discuss about occupational diseases, food and disease risk, and the 2nd to 5th units here. The 2nd to 5th year, various conditions related to condition and disease, which may be related to individual and functional syndrome, community lifestyle. This may include not confined to functional syndrome, metabolic syndrome, and related diseases, addiction, HIV, STI, and personality and malignancy here. Continue back. Here, the risk factors of disease. In the first week, we have actually 5 days now, from Monday to Friday, but tomorrow is holidays for our Indonesian Lahirnya Pancasila. Come back. We have 8 meetings. The first introduction in the morning here. The second, socioeconomic impact of illness and food and disease risk in the morning with webinar. Socioeconomic and impact of illnesses with Professor Diayi Mandari from public health, food and disease risk with me on public health. The next, malnutrition, food policy, carpal tunnel syndrome, tunnel syndrome, and cerebral palsy from Naivety. Occupational diseases, guest lecture from the occupational doctor, exercise of management diseases on physiology. We have in the first week a practical session with physical fitness, exercise stress test, and cardiocirculatory fitness is independent. The data from independent practice also Aston, I think, they will data for panel discussion. or lifestyle, our lifestyle. BCCP had promotion the long life of community training, tutorial, and regular physical exercise independent practices. Actually, the time of luring, we have regular physical practice every Friday, but no, in the no times we have online time. That's why you should make a video, one of your exercise training, one video from you as what time is it that you have data of your note, that is a notification for your what's it here. If you don't take the video, you don't have any what's it, assessment note. Okay, nilai ujian, I think so. Okay, the first week with risk factor diseases to be continued, Banana. The second week is functional syndrome. Here is the autonomic nerves. It's important in keeping healthy stage of the body. And its imbalance may cause several disorders and or diseases. Mental health is important in physical health, so that stress management is included in the health lifestyle. Here we have how many? Several lectures. The first is role of autonomic system of healthy life from physiology, sexual dysfunction, also from physiology, imbalance and autonomic nervous system from neurology, national and global psychological problem, psychiatry, psychosomatic disease from internal, dyspepsia, gastric heart, gastric, duodenal ulcer, and achalasia from internal medicine. The next month, here we have practical assessment level of distress. This is for your assessment yourselves. What kind of distress have you? And the second is nutritional assessment. You should prepare your height and weight datum for you to take the nutrition assessment practicum. We have discussed in the practicum with the nutritionist, and we will discuss what kind of your eating behavior, what kind of your food pattern. It is good or need not, you can find it in nutrition assessment and nutrition survey. Second is integrated patient management, and the next is tutorial. It's the same time. Okay. Continue, Ma. Should we continue? This is a scenario, immobile defenses. We know many people suffer from disease that has psychological underlying mechanism, psychosomatic disease such as irritable bowel syndrome and non-autonomical, it means dyspepsia. Management of these diseases is not merely by medication and drug, it also touches the physiological condition of the patient. continue. The next. The week 3 is metabolic syndrome and its related diseases. Here is metabolic syndrome, one of the cluster of condition: increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol and triglyceride level that occur together increase your risk of heart disease, stroke, and survival. We have several lectures. First, the management of metabolic syndrome from internal medicine, diabetes mellitus, complication of diabetes. This is all internal medicine. Stroke, the next disease from neurology, dietary, and of chronic diseases on internal medicine, a management obesity from internal medicine, obesity in children from pediatric. Actually, I know this is from the 10 of blocks found in pediatric, C3 or C4. Maybe pediatric is C4 or C3. Okay, the next, but there's also eating disorders from psychiatry, management of acute and chronic coronary heart disease, and prevention from cardiac disease, and also cold and hyperuricemia and osteoporosis from internal medicine. Did you know here high carbohydrate and calorie intake in the society lead to more than 5 million people suffer of diabetes in the country, which is one of the main factors for cardiovascular disease and stroke. Then we discussed in the third week, and also we have another activities. The next month, practical session, dietary program. Here from public health, you have the data from nutritional assessment, yeah, for yourselves, and you know that this data, the result, if you get a good food, what you say, good eating behavior, then the BMI normal or an obese or overweight or underweight, then to come in this practical session, you can make what is the normal, what is the need for my daily life here in the dietary program. Yeah. The next practical is PCCT here from a microbiology. The tutorial in the third scenario is community-based scenario. Here keyword is cassette. Addiction, coping stress, hopes about COVID-19. You know, it's the pandemic time. So many hooks in the social media, and you can find it, and you can discuss. You will discuss in the community-based scenario, and we've seen here 2 days before tutorial, should the scenario give to the secretariat. I think it's the same from the, you have learned about this community-based scenario from C5 and before, yeah. The next, Week 4. Week 4, we learning about addiction and HIV and STI. The addiction to drug is one of the main concerns about youth and adults. Indonesia is estimated to be the house of 5 million drug addicts. Furthermore, it's estimated to be the house that there is more than 1 million HIV infection in Indonesia, with hundreds of thousands are infected by sexual transmitted infection, many of which are without symptoms and underdiagnosed. That's why here we have learned in the lectures, first the substance-related disorders, psychiatry and diagnosis management, new psychoactive substance use disorders. And for pharmacology, we learn about pharmacological aspect of addictive drugs. For internal medicine, we learn about HIV and AIDS and comprehensive management of HIV infection. Another thing, how we consulting to HIV patient with the team from Satito Hospital. From dermato and venereology department, we learn about syndrome of genital discharge. The new map. Syndrome of genital ulcer, syndrome scrotal swelling and vegetation, and STD, HIV. For of skin, they need also STDs and complication. For internal medicine, we have COVID pandemic and coronavirus-related disease and standard transmission-based precaution. From public health, epidemiology, we learn is a public health management of COVID-19. And from internal medicine, we learn more than secondary prevention infection disease. There are 15 lecture in the third and the fourth learning unit. Is the right, yeah. Okay, that. Here we have, I have said before, panel discussion related, lifestyle related non-communicable disease. We have gotten from 3 practical sessions, psychiatry on mental distress, the second physiology, independent practicum, and the third is from nutritional assessment and nutritional program dietary. Every group make 5 slides to presentation. What is your lifestyle and how can you make it better lifestyle for you on the C practical and the literature as background. The next is PCCP, sexual transmitted disease examination. Tutorial with multi-level scenario. Tutor as a leader in this scenario, in this tutorial. Continue back. Big 5 is malignancy. The most common lifestyle-related malignancy are lung and colorectal cancer. We know that cancer is multifactorial disease, but many epidemiological studies have shown that smoking is the one factor that is strongly related to lung and also colorectal cancer. Here we have lecture background of this activities. Week 5, lifestyle at malignancy, lung cancer and colorectal cancer from internal medicine. From the radiology, we learn about radiotherapy and imaging of malignancy. we should know about this. A modern cultural bond syndrome and behavior addiction and adjustment disorders, PTSD, with psychiatry. Continue back. The next. Yeah, here the practical session from pathology clinics, glucose test, glucose challenge test, oral glucose tolerance test, Ketan bodies, HbA1c test, and calcium phosphate test. PCCT, we continue with advanced radiology and emergency. In the fifth scenario, in the 5 weeks, we have tutorial with module level scenario. And here also tutor as leader in this scenario. Here the what you say. This learning unit also consists 2 recently described conditions, cultural bond syndrome we have learned before, and violence in modern culture. Both of these conditions will affect the well-being of individual and our society. But I think this will be the end. The next, thank you. Have you another comment or question? Idea? Please. What is it? Here in the chat, we have, okay. No. Good morning, Prof. Yayi.
Permisi dok, saya izin bertanya dok.
Ya, silakan.
Apakah di blok ini ada absensi dok? Terima kasih.
Presency is okay. If you see here, all of you, and I ask you, how many people here, and I see the participant is 71, it means 3 is for us, a lecture and attending. The other, I think Mbak Nana have make a presentation. Right? Good. It's okay. Yeah. Mbak Nana, we have presentation at the time.
Mohon maaf, apakah ini maksudnya presensi yang seperti biasa untuk lecture itu?
I think so. Yeah. Ruth, is it so?
Ruth?
Ya, Google perlu isi Google Form nggak ya? Terima kasih.
Iya, nanti tak share ya. Nanti, saya tadi baru share screen. Nanti tak share. Oke, makasih. Ada yang tanya di chat.
Yeah. Excuse me, Dr. Will the tutorial session second session be conducted asynchronous? Yes, it's asynchronous. You have learned about Timbul. Have you? For the another C blocks, have you also Timbul? I think so. Yeah, Rafi, we have also Timbul, no? CLK and Timbul.
Yes, no, we have Timbul for every session of tutorial.
Yes. It's the second tutorial to be the Timbul. I think so. Thank you. Thank you, Naura. Have you another comment? Okay. Physical exercise in this pandemic, have you done regularly? How many people here? How many students here make a exercise regularly? I see here Salsabila. Have you also physical examination exercise? How many times a day or a week? Ayo, satu saja. Yeah, I see.
Yes, Dok.
Yeah, how many times a day or a week?
I think just 3 per weeks.
What kind of exercise? And then you should
From
make a
YouTube?
video. Yeah,
From YouTube,
Video
Dok,
for us.
usually.
yeah, see?
From YouTube.
From YouTube, fine. Okay, you should find a fitness have you. Another student here, have you another comment and question?
Excuse me, Doc. If I'm not mistaken, you mentioned that we have assignment to make video. Can
Yeah.
you repeat that? I
Uh,
missed that one. Yeah, I'm sorry.
Yeah. The video, but can you give me the assessment, but blueprint assessment? Actually, in the luring time, we together here in the medical faculty, we have every day a Friday session. But no, you are at home actually, yeah? Are you at home also? In your place, in your home place, home base, yeah? Then we cannot hear together to make a dance in the basket hall here. Then you make one, actually you should have physical activity not only one times a week, a Friday session, but every day you have a physical examination, physical activities. You make one of them a video, maybe 2 minutes, 3 minutes, to make a video for your physical examination, physical fitness. For us, as in Indonesia, say prasyarat untuk nilai ujian, ya, not the prasyarat lulus, but prasyarat nilai ujian. Okay, so Rafi, bring your video, yeah, then yes.
So we just have to record ourselves doing exercise
Yes.
for 2 to 3 minutes. Okay. Yeah. Thank you very much.
Actually, when we physical activity, not only 2 or 3 minutes, yeah, but for this video is 1 hour.
Yeah. Okay. Thank you.
Yeah.
Thank you, Doc.
Yeah. Welcome.
Dokter Istiti, mohon maaf, apakah sekarang sudah ke sesinya Bu Yayi?
Oke.
Okay. Karena sudah jam 8 lebih 10.
Yeah. I think it's enough. Then next you can also ask about everything for me or for the tutorial or for the lecture and so on. Write something. Yeah. Okay. Thank you. Bu Yayi, please, at your time, it's a good time in the first day after.
Thank you, Bu. Yeah, yeah. Okay, so I will share my my presentation. Yeah. So could you read clearly?
Yes, bro.
Okay. Ya, selamat pagi, good morning. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, salam sehat for you all. Yeah, hope that you are in a good health, good spirit. Yeah, for today. Yeah, so the theme that given to me is the socioeconomic of illness. So my name is Yayi Surya Prabandari. Daily activities, I'm at the Department of Health Behavior, Environment, Health, and Social Medicine. My office is located in the public health building, 3rd floor. Yeah, and when you enter the Faculty of Medicine. So in the left side, there is a third floor building. So that is the IKM building or Ilmu Kesehatan Masyarakat. Ya, gedung itu. Today we will talk about the what is socioeconomic of illness, and then I will remind you about social determinant of health, and then the pattern that show the shift of the disease in Indonesia from the communicable diseases to non-communicable diseases, even though now we are entering the pandemic of communicable diseases. And then we talk about the impact of illness and costs associated with the NCD. This is as a bonus, yeah? So you can read by yourself. So why we talk about the socioeconomic of illness? Actually, in the social determinant of health, economic is one of the factor that contribute to the health. Yeah. Maybe you already read that some of the articles show that the poor people that is often related to the diseases. Yeah. Then the socioeconomic can contribute your health. For example, if you already have a job and good job, and then you have had the payment or what we call income, yeah, the regular income, good income, you can have a good house, can buy food every day. I mean the healthy food, yeah, and then you do not face some problem like lack of water, lack of electricity. That in the side of the poor people, they lack of almost everything. Then it can be like, for example, tuberculosis. Yeah, tuberculosis is also one of the contributor is the not good house. Yeah, that don't have the circulation. Yeah, the air circulation, good air circulation. If you see some of the poor houses, yeah, they don't have a window. They only have a door. Yeah, and in the very small house. And bahasa Jawanya ada sih umpek-umpekan ya. It's so crowded in the house, yeah. And then one suffering from TB, then can be one house suffer from TB. So this is the socioeconomic can contribute to the illness. However, after you have a disease, yeah, you can also have the impact of the disease through your socioeconomic. For example, even though you are in a good income, yeah, but suddenly one of your family suffer from cancer, yeah, even though cancer already covered by the national insurance, but there are some a cost that you still have to add, yeah, because I have a research on cancer, then I know that they have to pay the accommodation because they are living in the outside of Yogyakarta, yeah, or the town, and then they have to pay the transportation, and then when you accompany your relative in the hospital, you need food, yeah. So there are some costs that beyond the insurance, national insurance. So when somebody's sick, this also can impact on the economic situation, yeah, even though not make you broke, but you will lose some money, yeah, when you are sick. So this is why socioeconomic of illness can be as a cause and as a effect. And this is I remind you about the social determinant of health, ya, faktor-faktor yang berhubungan dengan kesehatan, ya, yang dari sosial ekonomi. That I already explained a little bit, ya. When you have a good job, good income, you will have a good house, and then regular food, yeah, healthy food, and then you have the environment of your house is also good, yeah. It is different when you are living in the kampung with the poor environment, ya. Jadi ini adalah beberapa hal, ya, yang berhubungan. dengan kesehatan. Health is not just a outcome of genetic or biological processes, yeah, but also influenced by the social economic condition. Yeah. For myself, yeah, I feel that I used to study in Australia. Yeah. In Australia, the government is really monitor, I think, all the food and pangan. Yeah. They also monitoring the agriculture. So I'm very sure that the vegetables and fruits that I eat there, yeah, it's free from pesticide. It is different in Indonesia, ya. Kadang-kadang, because of so big the Indonesian, and then the health problem is also many, yeah. So it is a little bit difficult, but Indonesia is trying to go there because this social determinant of health finally also discussed at the United Nations, and then become one of the reason to modificate the Millennium Development Goal to the Sustainable Development Goals, ya, SDGs. Ya. Jadi ini menjadi bagian karena for the health of the nation and the people in the nation, the government, the country should consider and should have many programs that not coming from the Ministry of Health, but also from other ministry, ya, karena untuk kita dapat makanan yang baik itu termasuk Kementerian Pertanian, ya, so agriculture, Ministry of Agriculture, kemudian Ministry of the Women Empowerment, ya, untuk pemberdayaan di masyarakat, karena salah satu cara kita untuk bisa bergerak dengan baik. Ya. That I will show the pattern of disease in Indonesia that now before the COVID, yeah, but still, even though the COVID still here now, the prevalence of hypertension is highest in every, I think, in Java, yeah, in the health center Puskesmas now, the most prevalence of the disease is hypertension. Yeah, and this is no doubt because Indonesian people like everything to be fried. Yeah, gorengan seneng banget. Gitu. And then stroke is also increased chronic kidney failure ini because of the hypertension and diabetic that not controllable, that can be controllable, but some people not control it well. So that's why they have a complication, and one of the complication is chronic kidney failure. Ya. Kemudian juga diabetes ini hubungannya dengan stroke and also hypertension. Ya. It's just related each other. And then heart disease is still steady from 2015 to 2018. This is based on the riskesdas, ya, riset kesehatan dasar diambil pada seluruh provinsi di Indonesia. Ya. And then cancer is also increased, TB steady, yeah, but not decrease. And when we see this one is coming from the WHO NCD report, yeah, that for males this is increased, and then for females is also, but the decrease is we hope that there are decreasing of the case, yeah, but unfortunately it's not. Because in the riskesdas, riset kesehatan dasar, is as you already seen in the previous slide, that every NCD has increased. And this is NCD are estimated to account of the almost 3/4, yeah, 73% of deaths. Ya, dan paling banyak adalah cardiovascular diseases. Ya. Kemudian cancer, chronic respiratory, diabetic, and other NCDs. Ya. Meskipun yang communicable diseases juga masih. Ya. Injuries also contribute to the death. And this is the risk factor, but I will show because this is 2016. The report is 2019. Yeah, that this is coming from 2016 data, and then I found the other. what do you call, report, yeah, from the World Metric. This is current tobacco smoking. So I think Indonesia, so today is the World No Tobacco Day, 31 Mei adalah hari tanpa tembakau. So we hope that we can control the tobacco using in Indonesia, but still very slow because I already active in this activity since 2000, ya. Tapi pergerakannya lambat, and in Riskesdas the number of smoker in Indonesia is steady. Ya, belum pernah turun dari 60% yang laki-laki, ya. So males is always above 60% of the males population, ya. For females is up and down, but never reach 10%, even though my colleague in an NGO in Jakarta had a survey in 4 big cities, and then their group found that the female, especially the young female in Jakarta, Surabaya, Bandung, and Medan, is already reached up to 15% of the population, ya, itu di kota besar. Ya. Tapi kalau dari Riskesdas, wanita itu antara 3-5%. Okay, and then we still have obesity. Nah, obesity, I think Indonesia in the Riskesdas from 2010 that I observed, yeah, up to 2018. So there are increasing the body weight in every ages. Jadi ada penambahan berat badan di semua usia. And then the obesity, termasuk central obesity, is also increased from 2015 to 2018. Yeah. You can check in the Riskesdas, yeah, because I show all the slide is I just have only 20-25 minutes for presenting this slide. This is the cause of premature death in Indonesia based on the World Metric. Yeah, this is the difference between 2009 to 2019. That stroke is still number 1, and then ischemic heart disease is also still number 2. But diabetic is increasing, yeah, from number 6 to number 3. Yeah. And then if I see a lot of modern food at the moment, yeah, it's a lot of sugar, yeah, that I am worried. Yeah, young, it's like you, yeah, a lot of drinking, and then cake, and then I don't know, this modern food that I watch the offering, yeah, from the internet, from YouTube, yeah, from Instagram. So a lot of sugar, a lot of chocolate, a lot of fat. Yeah, this is worrying. Yeah, and I no doubt that why the diabetic increase. Yeah, and then cirrhosis also steady, tuberculosis is decreased. Yeah, and diarrhea is also decreased. Yeah, but this is 2019. Yeah, so we haven't faced the COVID. But the death from the COVID compared to the death of the NCD is still higher, the NCD. Yeah, this is the risk factor that drive the most death of Indonesia. This high blood pressure, as I mentioned, that hypertension is number 1 in the every puskesmas in Indonesia, mostly, ya. Tapi kalau di Jogja jelas. In Yogyakarta, every puskesmas, the number 1 is hypertension. And then tobacco, dietary risk, yeah. So that's why Bu Estiti, Bu Dr. Estiti, with her group, yeah, we have the special Blok lifestyle related diseases because of this one. Yeah, actually, why you also have to show your physical activity and then record it to the video. Actually, even though we don't have assignment, you should have a physical activity because the 3 Kermas, ya, Kermas activity that already be campaign by Indonesia is one is increasing physical activity. Kalau bisa tidak hanya physical activity but exercise, ya, karena ada sedikit perbedaannya. Nanti kalian akan mendapatkan kuliahnya, ya. What is the difference between physical activity and exercise? Kemudian makan yang sehat, ya, bijak, ya, so healthy eating. Kemudian juga memeriksakan kesehatan secara teratur. Tetapi Kermas ada 6 sih sebenarnya, termasuk salah satunya adalah kita menghindari rokok. Ya. Oke, so bijak dalam makan, saya masih muda kok. Ya, justru sejak muda, ya. So the impact of illness actually it can be derived to the poverty, because of the after you have diseases, ya tadi yang saya bilang, kemudian getting sick, and then you have to pay, because of the national insurance not pay of all costs, National insurance is only pay the medical things. I mean that obat, mungkin juga rawat inap, tetapi transportation, accommodation, mungkin kalau butuh obat penunjang lainnya yang tidak tercover BPJS, you have to pay that. Jadi population in low and middle income country increase exposure to common modifiable risk factor unhealthy diets. Kita sudah banyak makanan-makanan cepat saji, physical inactivity, tobacco use, harmful from alcohol. Dan ini led to the non-communicable diseases and getting younger. Jadi saya pernah tanya senior saraf itu yang termuda itu stroke itu berapa tahun yang lalu, 2-3 tahun yang lalu 18 tahun ya. Malah Bu Herini, dokter anak, Prof Herini told me that he just have a baby 2 years old that suffer from stroke. I don't know why this still in the research ya. Jadi mungkin sedang malah diteliti ya. Tetapi 15 tahun yang lalu saya tanya dokter saraf itu termuda di Jogja itu 30-an tahun. Then I ask again 5 years later menjadi di bawah 30 ya. And latest that I ask is 18 years old is obese ya. Ada seorang wanita obese dan kemudian terkena stroke. So jangan lengah meskipun Anda muda ya, karena kalau tetap tidak sehat hidupnya, you can suffer from NCD. And this is also become the care of the concern, not care, concern of the world, because of the NCD, that the cost of absenteeism and presenteeism. Absenteeism is you not go for working, not go for studying, Tapi kalau presenteeism itu you are going to the office, but you cannot work productive. So you only maybe that I have one staff at that time he just suffer from stroke and then he already recover but not recover 100% because before he can input the data from student like a day he can input like 50 to 100 student into the computer. This is his task. But after he suffer from stroke he just can work and inputting only 10. You can imagine from 100 to 10. So this is not productive. Jadi orang-orang yang suffer dari NCD itu kebanyakan memang mereka bolehlah bekerja tapi tidak boleh ngoyo tidak boleh terlalu keras So they can go for work but they are not productive. Dan ini ongkosnya cukup banyak Jadi this is estimate of lost GDP from NCD deaths, absenteeism and presenteeism in 12 countries. Indonesia belum terlalu tinggi tetapi sudah mulai jadi meningkat angkanya. Jadi ini yang kita kehilangan banyak biaya karena biaya untuk membayar BPJS-nya, biaya untuk kehilangan harinya termasuk yang bersangkutan including the sick person themselves Karena kan ada kantor yang kalau dia memang ada bulanan payment is based on the monthly payment tapi kan kalau Anda bisa bekerja dengan baik, beberapa kantor itu mempunyai bonus dan bonus itu cannot be given if you are not productive kamu tidak kualitas kerjanya tidak bagus. So this is presenteeism. It's also as bad as absenteeism. Previous studies show that although employees pay 80 times more on diagnosis and treatment charge than in prevention program, there is evidence that 50 to 70 all diseases are associated with modifiable or preventable health risks. And yet, 12 to 13 reduction in blood pressure can reduce heart attack by 21%, stroke by 37%, and all deaths from CVD by 25%. Therefore, Indonesia has Posbindu program after Posyandu. Posbindu itu 15 tahun ke atas, di mana Anda bisa datang setiap bulan untuk diperiksa tekanan darahnya. Jadi kalau tekanan darahnya agak naik, nanti akan diedukasi. Dan tentu saja harusnya juga diet yang proper. Ya. Okay, so now we are going to the cost. Yeah. What is economy evaluation? Is referred to both comparative cost associated with 2 or more healthcare intervention. Ini cost effectiveness. Dan comparative clinical effect measure either in clinical units, have preference or monetary. Ini bisa CBA, ya, cost benefit analysis. What is KALI is usually also as outcome of the cost effectiveness analysis. KALI is the quality adjusted life year, or quality adjusted life year is measured in disease burden. Yeah. So this is assessing the value of money of medical intervention, but the KALI model requires the utility independent. Yeah, so each year, if you are perfect, ya, nggak pernah absen sekolah gitu ya, selalu masuk gitu, Anda punya 1 kalinya dalam 1 tahun. Tapi kalau mati itu 0. Ya, so if you have to use the wheelchair, so maybe your KALI is 1.6 or 1.5 ya. Jadi ini perhitungannya seperti ini. Ya. So KALI is number of years life and utility ya, quantity or life, and utility is quality of weight that represented in the quality of life ya, human quality of life. Jadi misalnya pasien 1 utility-nya dia itu kalau dalam setahun itu bisa bekerja, mungkin absennya sedikit, kemudian 0,9 number of years-nya adalah 10, maka dia kalinya adalah 9. Pasien 2 utility-nya karena dia harus di wheelchair, pernah juga rawat inap, dia jadi setengah, number of years-nya 10, kalinya jadi 5. Ya, jadi kadang-kadang juga begini, ada sama-sama 5 years ya, tetapi yang satu kalau dia di treatment dengan A itu dia utility-nya bisa 0,8. Sementara dia 10 dikasih waktu bisa 10 harapan hidupnya 10 tahun ya. Tetapi utility-nya hanya setengah gitu ya. Jadi itu kadang-kadang di dalam BPJS itu juga di dalam perhitungan itu mereka memperhitungkan itu obat yang mana yang akan dipilih ya. This medicine can give the prolong the life but the utility is half. Or this is only 8 years, not 10 years, but the utility is 0.9. Kadang-kadang yang dipilih adalah yang itu, gitu ya. Jadi KALI ini integrate in mortality, morbidity related to outcomes, life duration and quality of life. Yeah. And there are 2 famous of the economic calculation, ya, cost benefit analysis and cost effective analysis. Cost benefit analysis and cost effective analysis, this is the popular method, and cost effective analysis related program cost in dollars or rupiah ya, to the amount outcome of achieved expressed in natural units such of pounds or weight loss. Jadi biasanya kalau cost effective analysis ini membandingkan 2 program gitu ya, and then they will compare antara harga programnya dengan harga sesudah program itu. You can avoid the cost for illness, dan mungkin juga karena Anda kemudian kehilangan, misalnya 2 program ini adalah program exercise ya, you lose your weight, and then because you lose your weight maka keluhannya jadi sedikit ya, jadi tidak beli macam-macam obat. Nah itu nanti yang akan dihitung. Yeah, it depends on the researcher. But cost-effective analysis is comparing 2 or 3 program, and CBA, this is the comparing the cost and benefit. Jadi tidak harus membandingkan 2 program, tetapi hanya 1 program bisa. Tetapi yang dibandingkan adalah biaya. Ya, biayanya bisa direct and indirect. Ya, jadi benefit hasilnya itu benefit itu yang direct itu adalah kita tidak banyak keluar untuk pengobatan, ya, tetapi benefit can be productivity workers. Jadi dia kemudian tidak bolos, bisa bekerja dengan baik. Nah, cost-nya adalah cost the actual expenditure of the programnya, ya. Misalnya service equipment, travel, materials, misalnya ini program untuk healthy life gitu ya. Cost-nya indirect-nya juga kan kalau dia ikut program itu dia kehilangan waktu ya. Jadi nanti dibandingkan antara cost ini dengan benefitnya. Ya, itu cost and benefit. It not always 2 or 3 programs, can be 1 program. Dan perhitungannya bisa tadi direct and indirect cost. Kalau yang cost effectiveness 2 atau 3 program, dan kemudian yang dilihat adalah efektivitas program itu di dalam cost ya. Ini juga membandingkan cost-nya, cost programnya dengan cost yang hasilnya gitu ya. Tetapi dia kalau cost effectiveness banyak membandingkan dengan 2 atau 3 program. Tidak hanya 1 program ya. Comparison of yearly budget, ini saya hanya membuat perbandingan ya, comparison very simple. This is my friend that already suffer from diabetic and this is me that I always eat fruit and vegetables, but vegetables is not cost money, but fruits a little bit ya. Jadi saya akan ngitung. Sebetulnya meskipun teman saya ini covered by BPJS, but he still have to pay like vitamin, and then not always when he goes to the doctor and then visit, and then if there is no complication or the BPJS now has regulation for Prolanis ya, program untuk yang sakit kronis itu. Cek darahnya itu tidak bisa setiap saat gitu ya, sehingga kalau dia pengen cek darah he has to pay by himself, or if you can buy bisa beli sendiri ya, bisa cek darahnya, dan itu ada cost-nya ya di luar BPJS, dan tetap lebih mahal sebetulnya orang yang sakit daripada orang yang sehat ya. Ini adalah beberapa example study ya, this is modeling impact on tax. Jadi supaya orang Filipina itu tidak makan yang manis-manis, pajaknya dinaikkan supaya konsumsi manisnya itu berkurang. Tapi ini masih pakai modeling ya. Modeling itu belum menjadi program yang benar gitu ya. So the tax, karena dia ini adalah pakai modeling using national data sources, we conducted an extended cost effective analysis to estimate the effect of tax on number premature death. Jadi taxnya dimainkan gitu ya. Jadi the largest number of death coming to 4th to 5th highest income quantile, the tax billion revenue per annum. Jadi ini kalau taxnya ditingkatkan ya di 41% additional tax ini, jadi bisa lowest packet payment ya due to healthcare, dia bisa estimate dari 13.890 case catastrophic expenditure can be tidak digunakan gitu ya. Jadi tax itu diharapkan bisa menurunkan konsumsi sehingga sakit, terutama diabetes ya, kalau konsumsi sweet itu bisa berkurang sehingga payment dari kayak kalau di sini BPJS, di sana dan national insurance-nya bisa berkurang. Yang ini adalah social cost benefit analysis CBA untuk meat taxation dan fruit vegetables subsidy for healthy and sustainable food consumption in Netherlands. Ini juga ya, jadi overall 15-30 price increase dan meat can lead a net benefit for society between 3.100, 3.100 and to 7.400 euro million, or 4,100, 12,300 million over 30 years respectively. So an increase 10% subsidized for the fruit and vegetables can net benefit sebesar ini. Ya, jadi kalau yang harga dagingnya dinaikkan, tetapi kemudian itu untuk memberikan subsidi pada buah dan sayur. Jadi buah dan sayurnya dibuat lebih murah, begitu ya. Sementara dagingnya dibuat lebih mahal ya, karena obesitas dan kemudian beberapa penyakit termasuk kolesterol ini kan sangat berkaitan dengan daging ya. Jadi, soalnya di sana sapinya gemuk-gemuk ya, jadi dagingnya itu banyak berlemak gitu ya. Jadi itu yang membuat banyak kemudian kejadian NCD. Jadi ternyata dengan menaikkan tax dan memberikan subsidi ini bisa menghemat sekian euro. Itu sekian euro itu adalah cost untuk sakitnya. Ini juga sudah dilakukan di Kenya dan juga di Uganda ya, yang di Uganda ini untuk HIV, and then in Kenya ini adalah screening service hypertension and diabetic ya, untuk epidemiologi impact ya. Jadi the integrated HIV and CD intervention could afford 7 to 76 million disability adjusted life years. Ini bedanya kali, kalau kali tadi adalah quality of life, kalau DALI ini adalah disabled-nya ya. Ya, jadi disability adjusted life years ya. Jadi ini bisa terkurangi kalau ada program itu dan bisa menghemat sekitar 6,68 miliar. Ya, cost effectiveness adalah 2.000 per DALI. Ya. Jadi ada yang bisa dihemat $2.100. Yang HIV, ya ini adalah biasanya dilakukan ya, health economic ini dilakukan untuk menghitung biaya ya, program yang biasanya nation ya, dan juga how we select the treatment ya, apakah treatment. Jadi BPJS itu melakukan banyak studi tentang cost effectiveness and cost benefit analysis untuk bisa menentukan which treatment that finally the government choose for curing the. Ya, saya kira itu ya. So thank you, and I give back to Bu Studi again, or if you have any questions related to this. Yeah, we just give introduction ya, because of the if you want to study more, you can pursue the master degree of finance, health economic, or finance management. Ya. We have in IKM ya, ada S2 IKM yang MAK, Magister Asuransi dan Pembiayaan Kesehatan. So you will learn more because more than 2 popular, because itu hanya 2 populer yang kita karena sebagai mahasiswa kedokteran, what you have to know is the way to read the articles ya. Tidak sampai menjadi ahli ekonomi kesehatan, tapi kalau Anda pengen menjadi ahli ekonomi kesehatan, Anda bisa mengambil S2 di ekonomi kesehatan atau finance. Oke, Bu Studi ya, but if you have any question. Bu Studi masih mute. Bu, mute. I cannot hear.
Halo,
Ya, sekarang sudah.
terima kasih, thank you, Prof. Yayi. My dear student, kuliah yang sangat menarik, this interesting one. Have you any question, a comment?
Yeah,
about it.
Yeah, before questions, maybe I just share myself. Yeah, I do exercise regularly. As WHO suggested, we have to do exercise minimum 150 minutes per week. Yeah, but because I know that during the pandemic, I a little bit more sedentary, because before when I work from office, yeah, I walk from Gedung Pusat, Gedung IKM to Gedung Kuliah to Tahir ya, to Radio Putro, and I usually use stairs ya. Saya jarang pakai lift ya. Then when I WFH, work from home, I just sit down. Yeah, so sitting down every hours. Yeah, so I add not only 150 minutes per week, but I add 100 minutes. So now I do exercise since the pandemic is 250. I think actually since 2021. Yeah. And then, yeah, fortunately, I'm still healthy. Yeah, I got genetic diabetic from my parents because both of my parents diabetic. And out of 4, I have 3 siblings. I have an older brother and 2 younger brothers. So all of them already taking the diabetic pills. Yeah. Fortunately, I checked my health last year, the beginning of this year, and my glucose level is okay. Yeah. So if you stay healthy, and do exercise regularly and then eat properly. Hopefully, my age this year is almost reached 57 years old. November, yeah, but I still can do swimming 1 hour, yeah, and then walking for 1 hour, yes, yeah. So kalau mau, makanya kalau diberi tugas hanya video merekam exercise-nya, ya, it's so simple, ya.
So simple. Yeah.
So simple, but not do it not only for this block, yeah, do it for every day for your investment, because health is investment. So you can practice your doctor for a long time if you are healthy.
Prof. Yayi is enforced. If the student come in the block C6, then they go to the gym.
Yeah.
Because really understand this.
Yeah, exercise is a lot of variety, ya. So choose based on your interest, ya, supaya tidak terpaksa. Yang senang apa, itu yang dilakukan. Senang nari ya enggak apa-apa, ya, karena di YouTube banyak, ya. Tinggal following the instruction. Ya,
Okay.
and then, yeah.
Siapa yang Nobody have any question?
Nggak apa-apa. Bayar gym itu kan mungkin kalau hotel itu 10 jutaan sekarang, ya. Zaman saya masih 7-6 juta per tahun, ya. Tapi itu kalau di ICU cuma sehari kali, ya. Biaya 10 juta sehari.
Perbandingannya, ya.
10 juta digunakan untuk exercise, kadang-kadang food and beverage-nya juga dapat diskon 20%, 10%, tapi pilihlah yang sehat, salad gitu, ya, sama jus gitu, ya, waktu nge-gym gitu, ya. Ya, jadi biaya yang dikeluarkan tuh kadang-kadang kita merasa agak mahal gitu, ya. It's expensive, ya, enrolling gym. Tapi begitu Anda enroll gym dan you use, ya, utility-nya itu ya 0,8 lah penggunaan gymnya. Mungkin Anda nggak sakit selama setahun dan Anda bisa menghemat uang sakitnya itu. Itu yang kadang-kadang nggak terpikir.
Benar-benar.
Oke, kalau nggak ada, 9 aku yang ngajar lagi.
Terima kasih Bu Yayi, thank you.
It's okay. Yeah.
Actually, this is an important thing for us. For the beginning of lifestyle, how is it? Because it benefit us healthy people. Yeah.
Yeah, healthy life is investment. Ya.
Yeah.
Jadi investasi jangka panjang dan Anda masih 20-an tahun, ya, ini, ya. Kalau Anda mulai healthy lifestyle-nya start from now, yeah, it's better for your life, from the next life, ya, future life. Jadi dokternya itu jadi kelihatan seger gitu, ya, jalannya bergairah. Pasiennya itu senang kalau lihat dokternya seger. Okay, thank you Bu Estiti. So have a nice day for today and good luck. Yeah, and then still stay healthy, and then always have motivation to exercise, to do exercise regularly. Ya, terima kasih Bu Estiti, thank you.
Terima kasih.
Live, ya, pamit, ya. Wassalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, salam sehat. Sekarang, ya, Bu.
Terima kasih, Dok. Saya share sekarang atau dari Dokter Istiti untuk materi selanjutnya?
Saya untuk lebih bisa bergerak, Mbak.
Oh ya, monggo, Dok.
Meskipun sudah ada di kamera. Ya. Next session here, and this is this. This is an opportunity to meet the second presentation, the second presentation in the morning. Food disease and disease list, because Prof. Yayi have explored before. For me, it's an opportunity. Food and disease risk. If you every time we have eating, Eating behavior, what kind of eating behavior have you? No, I asked about it. In the fact, we are explore before non-communicable disease kill 41 million people each year, 21% of that globally. Each year, 15 million people die. And over 85% is premature death in low-income countries. Cardiovascular disease have most of NCTs there. For group, this is account of 80% premature NCTs there. We have learned before tobacco use, physical inactivity, harmful of alcohol and unhealthy diet, increase of dying, detection and screening treatment, as well as palliative care, a key component of response of NCDs. They ask how dietary factor influence disease risk. Here's many research, and the researcher found that eating too much or too little of certain food and nutrients can raise the risk of dying of heart disease, stroke, and type 2 diabetes. Here, food and nutrient, and eating too much and too little about that. And the results suggest we to change eating habits and may have improved health. That's why we have practical about nutrition assessment. How is your eating habits? Because you will learn with record 24 hours. What kind of eating habits every time? We assess 3 times, in normal days, and the other is in the end or the special days. The next, we know that here. What is here? Look at me. Because they say we don't eat nutrient, we eat food. If you see this, in the morning you have breakfast. In the offline time, I can ask you to have breakfast before lecture in the morning. That's it. And this morning I cannot ask you, Carlo, have you breakfast in the morning?
Yes, Doc.
What kind of breakfast have you?
I had rice with boiled egg and also vegetables.
Have you started cooking this one?
My mom cooked the dish for me.
Oh, fine. You at home. Yeah, okay. Okay. And the pandemic or something like this, if you go or live in Jakarta, out of your hometown, then you maybe it's a younger people or so many people say, what can I do? What can I eat in this morning? Or if we have cooked something, but we will eat something, then ask go food. Actually, I tidak boleh ya makan go food here as lecture, but it's this is the good example at the time. We go and we put to send what we will. We don't know what is in the food then. What is nutrient or something like that? What kind of food? What kind something to make better smells? Yeah. The term non-communicable disease actually we have learned before. We have discussed. We used to make the distinction between condition and infectious or communicable disease. Characteristic here, the epidemic takes decades to become fully established and have their origin for young people. We are also mentioned before, more young people go to the MCDs. They require a long-term systemic approach to treatment. If you have diabetes or hypertension, you should take more medication every time. That will repair the diabetes. This is the from medicine side, medical side, long-term systemic approach. Even the long duration, there are multiple opportunities. Actually, what is the term of we have mentioned the burden of morbidity, cardiovascular disease, cancer, chronic respiratory disease, and diabetes. Yeah. They say the risk factors of today have the disease of tomorrow. What kind of risk factor actually? What can we know? What is the risk factor? The concept of risk factor here, the correlation what a disease that is, they occur together with the disease, not proven to be causal. Many people say a diet may contribute to several degenerative diseases. If we eat more, too much, and come to obesity, the next maybe syndrome metabolic. If don't have any treatment, then come to the MCD. A person family history and laboratory test result can reveal strategy for disease prevention. VIE has mentioned in the family that the parents have diabetes, and then this is a family history. But she also make the opportunity to a healthy lifestyle. It's better healthy, it's a better condition as the other sibling. This is the situation. And to say a person's family history and laboratory test result can reveal strategy for disease prevention. He has a good prevention for himself. The risk factor can controllable and uncontrolled. Here we see diet and body weight we can control. Daily level of physical activity, level of sun exposure, smoking, and alcohol abuse. We can control all the risk factors here. But there are also uncontrolled risk factors. Here, the uncontrolled risk factors, they are age, gender, ethnicity, hereditary. You see your hair eye color. The age body has a harder time protecting itself. Its ages. This gender, so the diseases are more common among members of genders. Men have heart disease and women breast cancer. Ethnicity, we say literature, African Americans are more likely to develop high blood pressure. American higher risk of diabetes. And so the health behavior can modify. It can modify the health behavior. In here, as an example, tobacco use, harmful alcohol consumption, unhealthy diet, you can disiplin kermas, They find from researchers, they have low fruit and vegetable consumption, diet high in salt. That's why we should take the fruit and vegetable consumption more. And the other one is insufficient physical activity. This is, again, controllable and we can modify behavior. So in this graphic, there are traditional race factors and modern risk factor. Actually, the traditional risk factor is the undernutrition, indoor air pollution. What is indoor air pollution? Maybe I asked to Rafi, what is indoor air pollution? At this time is certain. Rafi here?
Yes, Doc.
Can you explain what is indoor air pollution? The example here.
Probably when the air indoor is not clean, like due to smoke from cooking, or the owner of the house is
Fine.
has poor hygiene.
Yeah. This one, indoor air pollution, water sanitation and hygiene is actually the traditional race. But the modern race here, physical inactivity. The first is tobacco. We are yet mentioned 60% men that's a tobacco. Yes. Physical inactivity, overweight, here, urban air quality, road traffic safety, and occupational race. Yeah. There are resides from the traditional on the modern. The race transition over time measure race to have shift from traditional to modern here. Yeah. Here, if we see the nexus here, we have age, education, and income. If we put education, the income is going to fat intake, overweight, or alcohol or smoking. The risk factor for type 2 diabetes, cholesterol, and blood pressure. The next may be ischemic heart disease. But there was a nexus, keadaan yang berbagai hal di sini. Physical activity, fat intake, overweight, alcohol consumption, smoking, and risk factor here menyebabkan NCDs mungkin sampai ke sana. Mereka mungkin tidak dan langsung education dengan ischemic heart disease, but actually they can also modify the physical activity, modify or control the fat intake, or the potential for overweight. They don't come to ischemic heart disease because they have a good education. Yeah, this is the nexus of NCTs. The next one is the, can you see this? Mortality attributable of to diet. Here, so many things here you can say, but here is to climb to see what is here. So can you see here? Diet high in sodium, diet in low but whole grains, diet low in fruit, diet low in nut and seed. And here the first one is diet in high sodium, and the mortality to attributable here. The number of level of attributable diet Jadi kematian karena tingginya sodium di sini yang pertama kali di sini. Sangat tinggi. Kemungkinan karena jadi di Yogyakarta pun ada hypertension is the highest rate. Kemudian dia juga ada daily, we have learned before, daily is disability, the loss year of healthy life. Actually, they can prevent on the NCDs. The largest part of main chronic disease can prevent it if the risk factor eliminated. Here, heart disease, we can prevent 80%. Stroke also 80%. Type 2 diabetes can prevent 80% only. Cancer here only 40%. Yeah. The risk factor is common. Yes, learned before. Low in fruit and vegetables. That's why in Kermas, gerakan Masyarakat Sehat, the first is you should consume more fruit and vegetables. I think with pandemic, the consumption of fruit and vegetable increased because of the situation and pandemic here. Also smoking, alcohol, consume alcohol, physical inactivity here, more to go to the condition risk factor is major. This is here, cardiovascular, diabetes, cancer, and respiratory condition. Another one, obesity, rise blood pressure, rise blood glucose, and normal blood lipids, the risk factors of 3 here, cardiovascular, diabetes, and cancer.